Joining us first today is Dr. Erickson, a shoulder, sports medicine, and arthroscopic surgeon with ThedaCare. Dr. Erickson, welcome.
Glad to be here.
So you last joined us in July of 2022 before ThedaCare Medical Center-Orthopedic Spine and Pain opened. What has this center meant to you and the teams and the patients over the last 3 years?
Well, first of all, it's incredibly gratifying. I think most importantly, patient experience has been amazing. Quality of care has been amazing. And we can even say that and then say the data, the metrics back it up. And so I'm very proud to be part of that group that is pushing that forward.
You can see the data you hear from these patients, right? That the experience is different for them.
100%. Before, care would be very scattered. Here it's very centered, focused. Everyone knows where everything is, and the experience. The patients talk about the experience. I think of the previous state to the past 3 years, it's apples and oranges in a good way.
That's wonderful. So in recent years, ThedaCare Orthopedic Care has continued to strive to find ways to better serve our patients and communities. Let's talk through some of those. When we began offering care here soon after the center opened, we've continued to increase access. So why is that so important to expand access for our patients and our communities?
It's very simple. I think all of us in society, we don't want to wait. And many times waiting can lead to maybe potential lesser care and potentially even the risk of harm. So having an access point, 7 days a week, is just critical for the weekend warrior, the 10-year-old that gets injured on the soccer field. They want to have some comfort that they're receiving care. They're not hoping to receive care in the future. And that entry point, walk-in clinic, then gets them marching towards their definitive care in a much more expedited fashion.
Let's talk a little bit about walk-in care. Originally that opened with sort of limited hours and it's expanded, there's more access. Why is walk-in care so important to kind of get people through the door?
It's meeting their need. It's quite simply just meeting their need. They want to know what's going on and they want a path. None of us like the unknown. Getting some level of known and a path and a strategy, I think that just is human nature of where we are in our society today.
Yeah, it makes them feel comforted, right?
Right.
Okay, so to help those suffering from various types of injuries, a few years ago we began offering these different types of seminars, back, knee, pain. What are some of the topics or tips that you want people to know kind of coming out of those seminars?
I think the important thing, we do that with multiple providers and having them understand there's different ways to enter the system, and there's different care. It's not all about surgery. It's just as important, the non-surgical component. What does benefit from surgery, what doesn't? You have access to whether it's myself, a surgeon, primary care sports medicine, a pain management provider, that people understand there's just a multitude of ways to care for things. It's not singular, it's individualized.
That's great. So throughout the past 3 years, ThedaCare Orthopedic Care has added many new physicians, advanced practice clinicians, really just adding people to the team. Why is that critical to meet the needs of the patient?
Well, in many ways. Number one, access. You can't have a finite number of providers and think you're gonna have the same access. Number two, you always want to be recruiting talented individuals. And many times those talented individuals bring a different, unique perspective and maybe a potential unique skill set that's going to benefit the community. Collectively, we work as a team. And although you might see me, if I feel they have a diagnosis and the treatment's going to be better served by one of my other specialist partners, we hand off patients in a very appropriate way to make sure they're getting maximized care.
That sounds great for the patient. When we last spoke with you, we talked about an uptick in pickleball injuries. That's what you were seeing from some of your patients. Is that still holding true?
It keeps going up and up and up. So yeah, the pickleball injury, the phenomenon is a never-ending increase in the number of patients that we see for it. And once again, I'm all for it because it's good physical activity. It's social in the community. It's just you probably can't talk to someone who doesn't play pickleball now. 20 years ago, you'd never see a pickleball injury. Now in the clinic weekly.
Okay, what are some maybe quick tips and advice for people who are playing pickleball to help keep them injury-free?
Diving headfirst for anything is not a good idea.
No go, okay.
Don't dive for that ball, let it pass, move on to the next point.
Next point, okay. Next point,
Simple,
next play.
But sometimes the competitive juices get flowing and people, regardless of age, cannot help themselves.
I feel that. Okay, that's a really good tip. All right, finally, your focus areas are shoulder, sports medicine, and arthroscopic surgery. What do you see on the horizon for that type of care in the future?
There's a couple things I think about, and we do some of this now in very complex situations, the ability to make custom implants. I do see a world probably where something is getting 3D printed in the operating room. I think the other thing that all of us in all society wonder about, what is going to be the benefit of artificial intelligence in the care we deliver? Can we take enough data that we can't possibly organize or create an equation that could equal better care? There's so many variables that have taken into account that can supercomputing AI get us there and that we're delivering better care? My answer is I assume yes, but none of us know that time frame, that horizon, that trajectory. But I think that is where we're going.
That's exciting.
Very exciting.
Okay. All right, Dr. Erickson, thank you so much for being with us.
My pleasure.